Given that the first item on the agenda is the election of an interim chair and an interim vice chair, for the board secretary will preside over the start of the meeting. So hello, bonjour, Kwei. Thank you all for being here. I would like to start the meeting by honoring the Algonquin and Anishinaabe Nation land and people. Ottawa is located on unceded territory of the Algonquin and Anishinaabe Nation and is a gathering place for many Indigenous peoples. On behalf of the Board of Health and everyone at Ottawa Public Health, I would like to honor the land peoples of the Algonquin and Anishinaabe Nation, whose ancestors have lived on this territory for millennia, and whose culture and presence have nurtured and continue to nurture this land. I would like to extend that honor to all First Nations, Inuit, and Métis peoples, their elders, their ancestors, and their valuable past and present contributions to this land. A reminder for those participating on Zoom, please keep your microphones on mute unless called upon to speak. Those participating by phone, please keep the phone on mute at all times unless called upon to speak, and do not put the phone on hold. Please avoid using speakerphone when speaking, and please speak directly into your device's microphone or your telephone receiver. For those participating in person, please keep your laptop and mobile device on mute and use the tabletop microphones when speaking. Please also turn off your laptop speakers. As noted in the report listed at agenda item 8.1, section 57.2 of the Health Protection and Promotion Act requires that boards of health elect a chair and a vice chair at the first meeting in each calendar year. Further, section 5 of the Board of Health's procedure bylaw states that the city clerk or the board secretary shall preside over the election of the chair. Accordingly, I will be presiding over the beginning of this meeting up to and including the election of an interim chair. Given that context, and if there are no objections, I would like to change the order of today's agenda so that we can move directly to the motion to introduce reports and then agenda item 1, the election of the interim chair and vice chair, before returning to ceremonial and procedural items and the balance of the agenda. Are there any objections with reordering the agenda? Thank you. Hearing none, I will outline some meeting procedures, and then I'll ask Member Carr to read the motion to introduce reports. So, procedures for the Zoom meeting. The following procedure guidelines are being implemented to promote orderly proceedings of this meeting. Should members participating via Zoom need to leave the meeting, they should advise verbally that they are doing so before clicking on Leave Meeting from the Zoom platform or ending their call if participating by phone. The presiding officer will provide each member with the opportunity to ask questions or comment. Members will be called on to speak in the order or reverse order as set out in the board secretary's voting list. The usual 5-minute time limit will apply. Should you not wish to speak on a given matter, you may decline verbally when your name is called. If a full recorded vote is not taken for a given item, the presiding officer will specifically ask if the item is carried and then call for any dissents to ensure that all votes are properly registered. Procedural interjections should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order where you have not been called upon to speak, please state your name aloud for the record before stating your point of order. Should any technical difficulties or other unforeseen matters require recess during the course of the meeting, unless the board secretary issues new instructions, members are requested to remain on the line. The board secretary will mute all participants in such an instance. Member Carr, would you please introduce the motion to introduce reports?
Be it resolved that the report titled Election of an Interim Chair and Interim Vice Chair, the Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, the presentation titled Introduction to Ottawa Public Health Finances and the Report on Attendance at the Association of Local Public Health Agencies Winter Symposium be received and considered. And be it further resolved that the rule be suspended to receive and table the report titled 2023 Draft Operating Budget for the Ottawa Board of Health.
Is that motion carried? Sure. Thank you. Moving on to agenda item 8.1, the election of an interim chair and an interim vice chair. I will now open the floor for nominations for the position of interim chair. In the event that more than one member is nominated for the position of interim chair, a vote will be called. Member Carr, you have a motion?
I move that Councillor Catherine Kritz Kits be nominated for the position of interim chair for the Board of Health for the City of Ottawa Health Unit, pending the appointment of new public members to the Board of Health, after which a chair and vice chair will be elected for the remainder of the 2022-2026 term, to be confirmed at the first meeting of each year as required by the Health Protection and Promotion Act.
Thank you. Member Carr, do you accept? Yes.
Yes.
Carr. Thank you. I will call for any additional nominations. I will call for any additional nominations a second time. I will call for additional nominations a third and final time. Hearing none, Member Carr, would you move the motion to close nominations?
I move that the nominations for the position of interim chair be closed.
Is that carried? Thank you. And Member Carr, would you move the motion to appoint?
I move that the Board of Health appoint Councillor Catherine Kitts as interim chair for the Board of Health for the City of Ottawa Health Unit, pending the appointment of new public members to the Board of Health, after which a chair and vice chair will be elected for the remainder of the 2022-2026 term, to be confirmed at the first meeting of each year as required by the Health Protection and Promotion Act.
Is that carried? Thank you. Congratulations, Chair Kitts.
Thank you very much. Bit of a tongue twister name, I guess. I will now open the floor for nominations to the position of interim vice chair. In the event that more than one member is nominated for the position of interim chair, a vote will be called. Member Carr?
I move that member Tammy Diagiovanni be nominated for the position of interim vice chair for the Board of Health for the City of Ottawa Health Unit, pending the appointment of new public members to the Board of Health, after which a chair and vice chair will be elected for the remainder of the 2022 to 2026 term, to be confirmed at the first meeting of each year as required by the Health Protection and Promotion Act.
Member Di Giovanni, do you accept the nomination?
I do.
I will call for any additional nominations. I'll call for any additional nominations a second time. And any additional nominations a third and final time. I'll call for the close of nominations. Given that there are no additional nominations, Member Carr, would you please read the motion to close the nominations for the position of interim chair and the motion to appoint the interim chair?
I move that the nominations for the position of interim vice chair be closed.
Is the motion carried?
Carried.
Member Carr?
I move that the Board of Health appoint member Tammy Diagiovanni as interim vice chair for the Board of Health for the City of Ottawa Health Unit, pending the appointment of new public members to the Board of Health, after which a chair and vice chair will be elected for the remainder of the 2022 to 2026 term, to be confirmed at the first meeting of each year as required by the Health Protection and Promotion Act.
Is the motion carried?
Carried.
Congratulations, Vice Chair. Okay. So good evening, everyone. Kwe, Ayingai, Tanishi, bonsoir. Thank you all for being here tonight for the first meeting of the Board of Health of 2023. I also would like to acknowledge that we are meeting on unceded territory of the Algonquin and Anishinaabe Nation and to honor the Algonquin and Anishinaabe Nation land and people. In honor of this being the Board of Health's first meeting of 2023, we are privileged to have two elders with us here this evening representing the First Nations and Métis communities here in Ottawa to offer opening prayers. I would like to remind everyone to not take any photographs or video during any part of the opening prayers. Please join me in welcoming Verna McGregor, an Anishinaabe elder from Kitigan-Zibi, and Senator Parm Berge with the Métis Nation of Ontario, representing the Métis Regional Council. Turn it over to you. Trustee Elders, for those beautiful words and for gracing us with your presence this evening. I think we're all looking forward to a healthy 2023. Thank you. Board Secretary, can I ask you to conduct the roll call?
Member Banham,
Present.
Member Carr,
Present.
Member Dudas,
Ici.
Member Gower,
Here.
Member Kavanaugh,
Here.
Member King,
Here.
Member Lakin, Member Pinel,
Présent.
Member Tilly, Vice Chair Di Giovanni,
Present.
and Chair Kitts.
Here.
You have quorum, Chair.
Thank you. We have regrets this evening from Member Tilly. Are there any declarations of interest? Seeing none, can we confirm the minutes of the meeting of November 7th, 2022? Confirmed? And can we confirm the minutes of the meeting of December 20th, 2022? Thank you. We have 4 communications items that have been received and are held on file. We will now go through a consent agenda process. So for those participating or watching from home who may not be familiar with this, I will list each item on the agenda, and for any items where board members don't have any questions, concerns, or motions, and we don't have public delegations registered to speak, the board can carry or receive those items on consent, which means to say without any discussion. So item 8.2, Chair of the Board of Health verbal report. I'll be giving that, so will be held. 8.3, Medical Officer of Health verbal report. We'll be hearing from Dr. Etches, that'll be held. 8.4, Introduction to Ottawa Public Health Finances. We will be holding for a presentation. Item 8.5, 2023 Draft Operating Budget for the Ottawa Board of Health tabling. That will be held for presentation and questions. And item 8.6, attendance at the Association of Local Public Health Agencies Winter Symposium. Is that item carried? Thank you. We do also have one information previously distributed memo that was circulated in advance. It's the update on access to primary care for Ottawa residents. But I do know that there is some interest in this item. So is it okay if we hold this item for discussion as well? The will of the board? Yeah. Okay, so we'll hold that also. So now we will go back to the first item held, which is my verbal report, my first verbal report. So as January comes to a close, I'd like to note that February is Black History Month. This was officially recognized by the House of Commons in 1995 and has since been celebrated throughout Canada. It's an opportunity to learn the history of Black people in Canada, highlight their contributions to their communities, and celebrate their achievements. I encourage everyone to seek out and take advantage of the many opportunities to learn more about and to celebrate the history of Black Canadians. For Board of Health members, the board secretary will follow up later this week with a list of web links and resources that you can explore. Celebrating and learning about the history of Black Canadians is important and valuable, and is even more pertinent given the disproportionate impact that COVID-19 has had and continues to have on Ottawa's Black community. In June 2020, just a few months into the COVID-19, the Board of Health heard from Dr. Etches about some of the unintended consequences of the pandemic response and adopted a motion formally recognizing racism as a public health issue. The motion also directed the Medical Officer of Health to take a series of actions to address it from a public health perspective. Further, in September 2022, the Board of Health received the results of a diversity audit of Ottawa Public Health and approved a health equity, diversity, and inclusion action plan for 2022 and 2023. As such, OPH and the Ottawa Board of Health have made a commitment to addressing systemic anti-Black racism. Given this context, as you explore the resources that the board secretary will be sharing with us later this week, I also encourage board colleagues and indeed all OPH leaders to reflect on our respective roles, to challenge ourselves to go beyond learning about notable Black individuals and to mark Black History Month in a more meaningful and impactful way. I am also very pleased to share with board colleagues that 2 members of Ottawa Public Health's mental health, addictions, and substance use health team, Hoden Aiden, a supervisor, and Sarah Hafez, a public health nurse, have been selected to receive the Laurie Chow Memorial Award for their work relating to the Faith Leader Mental Health Skills and Capacity Building Training Initiative. The Laurie Chow Memorial Award recognizes health promotion excellence in Ontario. More specifically, it recognizes public health professionals who go above and beyond in their contributions to the work of health promotion. In informing Hoden and Sarah that they would be receiving this award, the Health Promotion Ontario Executive Committee representative noted that the Faith Leader Mental Health Skills and Capacity Building Training Initiative strengthened community action, created a supportive environment, and enhanced personal skills to address mental health concerns within the African, Caribbean, and Black community. In addition, your collaborative efforts throughout the planning and implementation process by engaging with faith leaders and persons with lived experiences is exemplary of a tailored initiative rooted in community evidence. The Faith Leader Mental Health Skills and Capacity Building Training Initiative truly demonstrates excellence in health promotion. Please join me in congratulating Hoden and Sarah, as well as the entire mental health, addictions, and substance use health unit for this successful initiative and well-deserved recognition. This concludes my verbal report, and I would be happy to take any questions. Seeing none, we will move to item 8. Oh, sorry. Do we receive the verbal report? Thank you. Moving along to item 8.3, Medical Officer of Health Verbal Report. Over to you, Dr. Etches.
All right. Good evening, Kwei, Nasukut, Santé, bonjour. And my thanks to the elders McGregor and Verdi for their support to the board to begin another year of work in a good way. And thank you for your reminders that we're all connected and that we need to strive for balance as we're doing our work, and that we need to deliver results. These were words that definitely resonated with me. Tonight, I will provide updates on our local situation with respect to respiratory viruses, also about children and youth vaccination, and the newly released guidance on alcohol and health. And with regard to Black History Month, I will be sending a message to all staff tomorrow, emphasizing the role of each Ottawa Public Health team member to work with and alongside Black community members, leaders, and colleagues to support the diverse Black community in Ottawa, which certainly is voicing what is needed for health of the community. So though the influenza season is still months from ending, influenza has decreased sharply to low levels, and RSV has improved. However, COVID-19 remains concerningly elevated in Ottawa, with each successive wave never really getting down to that low baseline between. Bien que la saison de la grippe ne soit pas encore terminée, la grippe a beaucoup diminué et le VRS s'est amélioré. Cependant, le taux de COVID-19 continue d'être élevé de façon inquiétante à Ottawa. So the hospital are continuing to feel the impact of COVID. And you may have heard me speaking in the media earlier this year that Ottawa saw as many deaths from COVID in 2022 as there were in the first year of COVID in 2020. Of course, just have to pause. Always when I think about the loss of life and the loss that people are feeling. And there was a declining trend of deaths in 2021, but that didn't persist. So clearly COVID-19 is far from over. The pandemic causing as many deaths in its third year as in its first was largely due to highly transmissible variants that caused more infections. It was a reduction in mask usage, and there's been slowing uptake of COVID-19 vaccination and increasing social interactions indoors. So these all give rise to more opportunities for transmission. And we see that these factors will continue to make COVID-19 a significant factor for illness and death into 2023. So we are seeing, like the World Health Organization recognized today, that COVID continues to be an emergency of international concern. And we're going to really continue our focus on protecting populations at highest risk for severe outcomes, including ongoing promotion of vaccination and outbreak prevention and management in congregate settings. And you'll see later our budget is continuing to support this work. And we continue to recommend that people consider the risks and those of their loved ones, the people they come in contact with, to use those layers of protection we've all been using throughout these winter months, which do help decrease the spread of respiratory illness. Nous continuons à recommander aux gens de prendre en compte le risque et ceux de leurs proches et d'utiliser les mesures de protection que nous avons tous utilisées au cours de ces mois d'hiver et qui ont permis de réduire la propagation de ce virus. So I need to say that wearing high quality masks, staying home when we're sick, and getting your vaccines are all important steps that will continue to help us keep our communities safe. As a further update, last Thursday, Dr. Kieran Moore, Ontario's Chief Medical Officer of Health, released a statement which, among other things, he was urging ongoing vigilance because many jurisdictions across the province are seeing a rise of the number of cases caused by the variant XBB.1.5. And though this variant hasn't been associated with changes in severity of illness, it may be that more people become infected due to its transmissibility. And in his statement, Dr. Moore noted that the province's guidance for PCR testing has been updated to align with the current recommendations for who is eligible for the Paxlovid treatment. La déclaration de Dr. Moore a aussi souligné que les directives de la province concernant le dépistage de PCR ont été mises à jour pour s'aligner sur les recommandations actuelles concernant les personnes qui devraient recevoir le Paxlovid. So notably now, this is anyone 60 years of age or older qualifies for PCR testing, regardless of vaccination status or other risk factors. And anyone 18 to 59 years of age now qualifies if they are immunocompromised or have more than one comorbidity, a health condition that puts them at risk of severe illness. And that's if it has been at least 6 months from their last COVID-19 shot or infection, or if they are not vaccinated at all. So these free PCR tests are offered at any provincial testing location. You can find those online. And rapid antigen tests continue to be available at no charge as well in a range of retail locations. And the province maintains a database of locations where you can find rapid antigen tests on their website. But I do want to emphasize putting these two ideas together of access to treatment and testing, that access to treatment with Paxlovid does not require a positive PCR test. So people eligible for treatment need only have a rapid antigen test that's positive. It can be a self-administered test in their home. And so there's really fewer barriers to treatment. People can go to a pharmacy, go to other points of access for the treatment. And our community engagement team is emphasizing this message. Our community engagement team continues to actually distribute rapid antigen tests in priority neighborhoods. So I will switch topics, but welcome your questions afterwards to talk about the children and youth immunization coverage. And I know I'm speaking some new members on the board, but those who have been with Ottawa Public Health's board for a little while understand that the disruptions caused by the COVID-19 pandemic, including closures to healthcare offices and schools, have meant that many children and youth are behind or have missed out on routine childhood vaccinations. And our grade 7 school-based program offers hepatitis B, human papillomavirus, and meningococcal vaccines. That was greatly impacted. So school closures, that allocation and deployment of staff affected the school years from 2019 to 2020, 2020 to 2021. And it was really in 2021 to 22 that we started to look at how we can catch up. Though there were still disruptions with school-based vaccine programs, there was still virtual learning put in place. And so Health Ontario recently published a report on the immunization coverage for grade 7 school-based programs. And the report highlights that Ottawa Public Health catch-up efforts have improved hepatitis B, in human papillomavirus and meningococcal immunization coverage more recently. So for example, our targeted immunization catch-up moved hepatitis B coverage among Ontario students aged 12 years old in the 2020-2021 school year from 23% coverage up to 63% coverage by the end of the next year. And the report shows that Ottawa Public Health's immunization coverage is above average across the school years and across health units in Ontario for all the 3 vaccines. And there's still work to do because the immunization coverage for students impacted by the COVID pandemic is still lower than pre-pandemic years. And so we have, for example, the immunization coverage for meningococcal disease is lower at 78% among those Ottawa students aged 12 in 2021, 2022, compared to 88% when we look back to the 2018-2019 school year. So we're continuing to offer the catch-up vaccination in schools for both grades 7 and 8 and beyond. Catch-up clinics are available in high schools, and students who were unable to receive their vaccines in schools, maybe they left school, they can still get their vaccines at one of Ottawa Public Health's family vaccination hubs or some of our neighborhood health and wellness hubs. And children who have missed out other vaccines, so we've talked about that, there are other, not just school-based vaccines, other barriers people are facing with routine vaccination through a healthcare provider, like family doctor. We are also working to make sure that people can receive one of these vaccines at our family vaccination clinics. And we're working with the Kids Come First, Can Immunize, and community partners to offer additional access to these routine vaccinations through the winter and into the spring. Les enfants qui ont manqué d'autres vaccins de routine et qui éprouvent des difficultés à se faire vacciner par un fournisseur de soins de santé peuvent également recevoir ces vaccins dans une des cliniques de santé publique Ottawa. Et on collabore avec le programme Les Enfants avant tout, Can Immunize et des partenaires communautaires pour offrir un accès supplémentaire à la vaccination de routine des enfants cet hiver et ce printemps. So we have also sent out letters to students who were born in 2005, 2015, and that is when the record that we have shows an immunization is missing or where there's inaccurate vaccine information. So we sent out one round of letters and we're just about to send out another round of letters, a second round. We see some uptake. Families are responding to that first letter and updating their vaccine information. And we'll begin that in the coming weeks for those who haven't responded. And then for children who aren't in school, we are working through our other programs like our Healthy Growth and Development program to share information about where people can be vaccinated and promote staying up to date. We work also for the school boards, with the school boards, to make sure when children are registering for kindergarten that they're able to promote vaccination. So lastly, on this subject, there's a National Kids and Vaccines Day. And I'm looking at our vice chair, who probably, her team is getting ready to celebrate this. Most likely it's coming up on February 23rd. It provides an opportunity to promote the uptake of routine vaccination. Cet événement offre une occasion de faire la promotion de l'adoption de la vaccination systématique des enfants. So Children's Healthcare Canada and Science Up First, they're holding a free Kids and Vaccine Town Hall event. It's going to begin at 8 p.m. There'll be a panel of healthcare leaders and experts from across Canada promoting uptake of routine childhood vaccines. And they'll speak to flu and COVID as well. And so I wanted to encourage all of you to sign up and spread the word about this town hall if you're encountering people with questions. So that's something the board secretary will follow up after tonight and give you more information about that. So lastly, turning to alcohol and health. On January 17th, 2023, the Canadian Centre on Substance Use and Addiction, otherwise known as CCSA, released Canada's guidance on alcohol and health, and it updates the recommendation from 2011, where we had low-risk drinking guidelines. Really the most notable change is that the science demonstrates that even with low and moderate levels of consumption, there are health and safety risks, and that the risk of harms increases with increasing consumption. Therefore, regardless of a person's level of alcohol consumption, decreasing consumption will decrease their risk. Peu importe le niveau de consommation d'alcool d'une personne, une diminution de sa consommation réduira son risque. So the 2011 low-risk drinking guidelines recommended no more than 10 drinks per week for women and no more than 15 drinks per week for men. And in these, there's no differentiation between women and men, and there's a continuum of risk for alcohol-related harms that is presented. And so it leads to the following guidance. There is negligible to low risk for individuals who consume 2 standard drinks or less per week. There's moderate risk for those who consume between 3 and 6 standard drinks per week, and increasingly high risk for those who consume more than 7 standard drinks per week. And each additional standard drink increases the risk of alcohol-related consequences. This updated guidance also outlines that consuming more than 2 standard drinks per occasion is associated with an increased risk to harms to self and others, including injuries and violence. So these guidelines are really continuing to highlight other important points, like when pregnant or trying to get pregnant, there's no known safe amount of alcohol use, and it's best not to drink when breastfeeding. The CCSA has included a technical report in the new guidance that outlines the extensive literature review that was behind this summary. And the research demonstrates that there are significant risks for several common types of cancer, breast cancer, colorectal cancer, for heart disease, so doing away with the myth that alcohol is good for your heart, for stroke, for violence and injury. And this report is designed to provide Canadians with accurate and current evidence-based advice, information to support people in making their decisions about use. So the updated guidance is recommending a harm reduction approach, meeting people where they're at, providing information and helping people understand that even these moderate reductions in alcohol use could reduce risks of harm for them. A recommendation in this bringing forward of this evidence has also been made for Health Canada to require through regulation mandatory labeling to list the number of standard drinks in a container, health warnings, nutrition information on alcohol. And in 2021, just for those again who are new to this board, Ottawa Public Health had brought forward a report on mental health addictions and substance use. And at that time, the board supported the need to review and evaluate the impact of increasing alcohol availability, the marketing and the promotion using a comprehensive approach. And that would include a review of labeling and health warnings. So the new recommended lower risk guidelines, they propose significant reduction in consumption of alcohol for all ages and all. Reception of this messaging, I think, is mixed. You can see that in the coverage. And, this isn't surprising given the normalization of alcohol consumption in our society. So changing the culture around drinking to minimize the harms in Canada and here in Ottawa, it will take time and collaborative efforts, discussion and engagement, including by Ottawa Public Health. So Ottawa Public Health's plans at this point are to develop a comprehensive communications and outreach plan. We want to inform residents and community partners and City of Ottawa staff about these recommendations. We'll be working to educate and build capacity using a harm reduction approach, again, with partners, community intermediaries, residents, that would promote substance use health and wellness and reduce the harms related to alcohol consumption. When we inform city staff and residents about this guideline, it's also an opportunity to remind people about where they can access resources and services for those who are questioning their relationship with alcohol, and for those who would like additional supports to reduce their consumption. So Ottawa Public Health will work closely with the CCSA and our many partners to promote health and wellness, to prevent onset of illness, to reduce the stigma that can be associated with alcohol use, and to support individuals to access those services and supports. And really, we're promoting Access MHA. It's a single point of contact to access a network of partners that provide alcohol, substance use, and mental health treatment and counseling services to people across our region. Santé publique Ottawa continuera de travailler en proche collaboration avec le Centre canadien sur les dépendances et l'usage de substances et ses nombreux partenaires afin de promouvoir la santé et le bien-être, de prévenir le développement des maladies, de réduire la stigmatisation et d'aider les personnes à accéder aux services et au soutien tel que le réseau Access SMT. So that concludes my report, and I'm happy to take any questions. Merci.
Thank you very much, Dr. Etches. Very informative as always. So to facilitate the hybrid format, I will be calling each member by name in reverse alphabetical order if you have any questions or comments. So to begin, Membre Pinal, s'il vous plaît.
No question, but thanks for the report.
Thank you. Member Lakin.
Thanks, Madam Chair. Just turn this down so I don't echo. Thanks, Madam Chair. Thanks, Dr. Etches. Picking up on your information about immunization patterns and the decline post-pandemic, do we have any data that will help inform how to improve immunization rates post-pandemic? I'm wondering, local data, I'm wondering, for example, did we know anything whether it follows the lines of other health inequities, or if there are other contributors that we're aware of that can help us increase uptake of immunization locally?
So the question, I know Marie-Claude's trying to hear from over there as she leads our immunization program and may want to jump in. I mean, the question about what data do we have to inform efforts to increase vaccination coverage? So most directly, we have information in our database of who's immunized or not in terms of their records being up to date. That's not necessarily who's immunized or not, but their records aren't up to date. So the data we get as we reach out, it is something we can look at by neighborhood, we can look at it by school. And so that allows us to target our efforts. And in fact, maybe Marie-Claude, you would like to describe how we are using that data and information to choose where to offer clinics and supports.
Yes, thank you. That's right. So as Dr. Etches mentioned, we did send our notices to children who were born 2005 and 2015, who were, our records were showing they were not up to date. Some parents have updated the information, and we are now looking at the data to see if there's any targeted approach that we need to do, let's say in certain neighborhoods where people have barriers, where we can do a different approach to make sure that they have access to the vaccine. We're also, as mentioned, working with Kids Come First and other partners to make sure there's access across the city for people who need vaccines.
Thanks to you both.
Thank you, Member Lakin. Member King, please.
I guess just briefly, I had a question on whether the neighborhood wellness centers are being leveraged for the child immunizations.
Yes, again, Marie-Claude was able to provide more detail on that. Short answer is yes.
Yes, they are. We're expanding the number of wellness hubs that are offering childhood vaccination. We're currently at 6. We started with 3. We're at 6, and we are increasing. The goal is to have all the neighborhood hubs offering routine vaccination.
Excellent. Appreciate that. Thank you.
Thank you, Member King. Member Kavanaugh, please.
Well, thank you very much, Dr. Etches, for the report. I appreciate very much that you're embracing the new guidelines for alcohol. I think that's really important, and I think it sends a strong message that we have to change the way we think, and it must come at a very strange time after the pandemic, and I think people may have gotten into bad habits. So I think it's good to be reminded of the health risks. So thank you.
Thank you, Member Kavanagh. Member Gower.
Thank you, Chair. I have no questions, and my only comment is I am encouraged about the significant improvement in the uptake of the childhood immunization program. So that's good to hear. Thank you for the updates.
Thank you, Member Gower. Member Dudas.
I have no questions at this time, and thank you for the update.
Thank you. Vice Chair DiGiovanni.
Thank you for the update, and lots going on at OPH, so I'm happy for those highlights. Question around the vaccination piece, near and dear to my heart, as you note. We're, I think, lucky in Ottawa because we do have access to the Can Immunize app that sort of provides all that information to OPH. So two questions. Do we have a sense of how many reports, like the proportion that are coming in through the app versus the old cards, so to speak, and any movement or advocacy?
I'll speak to the second part first, and then Marie-Claude can probably talk about what we're seeing with the use of the Can Immunize app. Yes, so unlike every other vaccine in Ontario, for COVAX, as a database, as a system for all the COVID-19 vaccination, we can tell exactly, how that vaccine's been given to people. Like, we know if it was done in a pharmacy or a primary care setting, we still can put it all together. It's a real live database that gives us the information and isn't dependent on somebody phoning Ottawa Public Health or emailing Ottawa Public Health to get the data. So it's absolutely something that we'd like to build on. And we've noted this, and the province is thinking about this. So is this the start of a true vaccine registry? It could be. It obviously is a provincial jurisdiction, to think about extending this. But this board has said we need a vaccine registry, and we are wanting to build on the progress that's been made. We know it's not perfect because it doesn't integrate with other people's systems in primary care offices. So there's some of these hurdles to truly make it as easy as possible to get all the vaccine information in, our active points of discussion, I believe, at the provincial level. And I think this is also something we've had the opportunity to highlight at the federal level. So again, you had an opportunity to meet with the federal Minister of Health in a couple of months ago, and we also said at that meeting that this is something we need across the country because people move from province to province, and you should have your immunization records up to date with you. So Can Immunize is an excellent tool. We like it because it's easy for families to use, and it does avoid them having to make that phone call or send in information. So maybe you want to speak more to that, Marie-Claude.
Yes, thank you. So Can Immunize app, we do promote that app in our clinics, even with new families when our Healthy Babies, Healthy Children nurses do visits with new parents. So it's a good habit to have. It's a great way to keep all the vaccines in your phone, so it's very handy. In terms of the number of submissions that we get through the app, I don't have that stat with me today, but I can definitely get it. Yes, we can pull that information. It is definitely growing, the number of people who use the app, and that's what we want to see. So I can get you those stats.
Perfect. Thanks very much.
Thank you, Madam Vice Chair. Member Carr, please. Thank you. And Member Bannon, please.
Hi, it seems you've been very busy over the last month since we last met. Thank you for your report. The only question I had was for the routine vaccine clinics, is the Tdap vaccine offered as part of this routine vaccination? And the reason I ask is that we've seen recently outbreaks of whooping cough in Alberta, and just looking to see if that is covered within what public health is advancing, and if not, if that is something we can look into.
Yes, that is one of the vaccines that is routinely given in childhood, and also we recommend a booster shot for adults for tetanus. So these are vaccines that we would offer if people are having difficulty accessing their primary care provider.
And I can also add that this is also a vaccine that we offer in our high school catch-up. So the high school catch-up, we offer the school vaccine, so the hepatitis B, meningococcal, and HPV. But we've also added the Tdap vaccine for youth. That's the booster that they get at 14 to 16 years old. So we make it even easier for them. They can get it at school.
Wonderful. Thank you. That's all for me.
Thank you, Member Banham, and thanks everyone for your great questions. I know there was some discussion in another committee about level 0 and paramedic offload delay, and there was some questions from some of my colleagues. So maybe for the benefit of some new members and new members of council, if you could comment. I know it wasn't covered in your report, but just OPH's perspective on that and the role as well. Thank you.
Sure, I'll do my best, but this is really not my operational area in terms of running hospital emergency rooms or the paramedic service. So I think when you hear that terminology, offload delay or 0, ambulance available, what people are referring to is that paramedic teams arrive in emergency rooms and need to hand over care to hospital staff. And so there are many different ways people are looking to streamline that system. I think different hospitals have implemented various things in terms of more space, more staff, different staff to hand over to. But hospitals are certainly seeing a high level of demand for their services in emergency rooms, respiratory illness, as well as many other conditions that people are showing up with needing more urgent care. Actually, the people who are coming to emergency rooms, my colleagues tell me they're showing up, with more illness later, in the course of the disease than perhaps previously. And so that puts pressure on the system. So from my point of view as a public health physician, I think these are health system issues that I know are best looked at across. It's no one organization, there's no one solution. We need to think about all the pressures on the system, and the body that's responsible for that is Ontario Health. And they have set up different structures to try to help with the flow of people in the hospital system. Maybe it's complex. Sometimes the emergency rooms are full because people are admitted without a bed, because people in the hospital beds need care in a long-term care home. Like there's many ways the whole system really is connected. And it's so, Ontario Health's working to look at making sure people who don't need to be in hospital are able to find that, care that they need and support in other settings. So, as I say, we're a partner with Ontario Health. We are part of conversations sometimes around emergency planning. But I personally don't have a role, or Ottawa Public Health doesn't have a role in implementing specific solutions within that care system. We do have a role to try to keep people out of hospital. So that's what we're focused on. We want to continue to do our part. Again, immunizations, part of keeping people out of hospital. The outbreak management work that we do and the support to long-term care homes is also really important, because some of the people in hospital who need another place to be, you need to be in long-term care, but if there are outbreaks in long-term care, it can slow down the process of repatriating people. So we have a role to play in those regards. Overall, promoting healthy aging, supporting caregivers. A lot of families are providing care in the community, and that takes a toll. So some of our work around health promotion and, supporting people in the community, older adults, these are ways that we can contribute as Ottawa Public Health, and really with that focus on prevention. I don't know if anyone else would like to add, but Esther and Andrew are leading some of this work with older adults or infection control, but I think you get the idea. Yeah. Does
Great.
that answer your question?
Yes, it does. Thank you very much for that. Okay, can we receive Dr. Etch's verbal report? Thank you. We'll move along now to item 8.4, Introduction to Ottawa Public Health Finances. So I'll ask Joanne Henderson-White, Program Manager, Performance and Corporate Services, to give a presentation, please. For those joining us online, we'll just give a moment to get seated here.
Onokot, good evening, Chair and members of the Board of Health and OPH team and leadership. The objective of this presentation is to give you a high-level overview of the aspects of our financial functions that are relevant for today's meeting as we table the 2023 OPH draft operating budget. I will briefly explain some of the rudiments of the OPH budget from a foundational perspective. I will summarize the Public Health Services mandate, specifically our requirements and responsibilities, provide some insight into some of the considerations involved in building the annual operating budget, following which I will provide an overview of the main programs and services delivered by OPH and their funding sources. I will briefly describe accountability requirements and provide a quick review of the budget cycle development and approval timelines, and close with some of your responsibilities as the Board of Health related to the budget. Some of the foundational points about the budgets for your consideration. Care is taken to develop the budget, and estimates are made in consultation with the city's finance department. Guidelines for development are outlined in the budget direction and timeline and consultation process issued each year. Ottawa Public Health's budget consists of contributions from 3 funding sources: funds from the city and provincial funding through cost-shared programs, and other revenues such as funds received from fees for services. The budget reflects organizational priorities that aim to address community needs, support OPH's strategic directions, address current and potential future pressures, and we have to indicate as well that a balanced operating budget is required each year. So I've just highlighted some of the foundational points. The core functions of OPH are population health assessment, surveillance, health promotion, disease prevention, health protection, and emergency preparedness and response. In carrying out this work, we are required to meet standards described in the next slide. The programs and services developed by OPH are guided by Ontario's Health Protection and Promotion Act, or the HPPA, which provides the legislative mandate for local public health units. The Ontario Public Health Standards outline the requirements for programs and services. The Accountability Agreement framework recognizes the need to achieve better health experiences and outcomes and effective oversight of public funds. There are many different considerations in the budget development process, some of which include the needs of the community identified through health assessments. Health assessments describe the state of health of a population, identify major risk factors and causes of ill health, and the actions needed to address them. The other consideration is the cost of living and benefit adjustments, or COLA, determined by collective agreements. We also think about inflation, which allows us to, consideration of which allows us to maintain existing services. Growth, both in new services and the population, are also important consideration. We think about the funding levels or the amount of funds that we assume will be received from our major funders, the city and the province. And we look at the strategic operational plans that include input from municipal and community stakeholders. And this assists in a robust development process. So this is the list of the programs and funding sources. And as you can see from the list, there are some programs that are cost shared at up to 70, the ratio of 70 to 30%, with the province covering the higher percentage. Some of the examples of the cost shared program include the Healthy Growth and Development Program, food safety, substance use, and mental health programming. Other programs are fully funded by the province, and those include the Ontario Seniors Dental Care Program and Indigenous Health. The city funds additional programs, for example, mental health and school outreach. Other sources of revenue support OPH's programs, for example, fees and services, OHIP billing, and dental recoveries. The next slide provides a high-level view of the budget breakdown by percentage. So I just wanted to give you a sort of a graphic to illustrate the breakdown. And this figure really highlights the fact that OPH is service-driven. The bulk of funds are allocated for salaries and benefits. So we are a service-driven organization. OPH programs and services have systems of accountability. We're required to provide reports to the Board of Health, to you, the Ministry of Health, and the Ministry of Children and Youth Services. And just to give you an idea of some of the reports that we provide, those include quarterly reports, operating status reports, and standard activity reports. And I wanted to take a moment just to raise a point of note that the quarterly operating status reports that we provide to you as a board captures reporting on all in-year changes. So anything that changes in terms of funding throughout the year, it will be captured in the quarterly operating status report. And one-time funding received, for example, when we received COVID-19 funding. So with all of the reporting, we are also subject to annual audits. And the annual audits involve the finance department and the external auditor. So now, just switching from the technical aspects of the budget, these are the 2022 to 23 list of activities related to the budget cycle and their timeframes. So you can see that the budget planning process begins in the summer and goes throughout the cycle. Normally, as I said, begins in the summer and ends with the final approval, which will take place this year in the beginning of March 2023. So to summarize, in this presentation, we have discussed budget foundations, give you a very high-level view. We looked at the public health services mandate, budget development considerations. So what do we think about when drafting a budget? We looked at our funding model and talked about the cost shares and those covered from fully 100% funding. And we also looked at accountabilities. So now I will conclude with some of your major responsibilities as a board related to the budget. Ottawa Public Health has a legislated duty to ensure the provision of public health programs and services to the citizens of Ottawa, and to govern these programs and services in the public interest, including fiscal and administrative oversight. The Board of Health's main responsibilities related to the budget include setting directions for us at OPH through your input in formulating our strategic priorities. We also expect that you approve the annual budget, which is coming up in draft form. And also you're also responsible for providing oversight by receiving and reviewing quarterly budget status reports and ensuring community input and evaluation informs each budget cycle. This concludes my presentation on the OPH insight on our financials. Merci, thank you. Napromik Miigwech.
Thank you very much, Joanne. So we will go to questions. We'll do alphabetical order this time, so the reverse. So to start, Member Bannum, please.
No questions. Thank you for the presentation.
Thank you. Member Carr.
No questions, thank you.
Thank you. Madam Vice Chair.
No questions, thanks.
Member Dudas.
Yeah, I have a quick question. In terms of services, our city is geographically huge. We often talk about how many other municipal jurisdictions can fit within our own boundaries. And we know that, living in rural areas, there's not as easy an access to whether it be city services or OPH services. And I was just wondering, in terms of ensuring that those living in further flung areas, the rural areas, may not have access to bus routes or things as readily as some people in the core. How does OPH make sure that those services are provided in those areas, or is there consideration given to extending services to those areas in pockets where it's more difficult to access?
Thank you for the question. Yes, this would be part of the process we use to consider community needs. And when it comes to each program, to think about the breadth of our city and priority neighborhoods. So it does occur that we tailor our services at times to adjust for the difference of people's experience and barriers in rural areas. So for example, the immunization program, often if there isn't the same access to pharmacies, for example, will support with greater number of clinics in rural areas. part of the budget for some of this work is the greater mileage, those kinds of things. So it's built into the program costs that we need to serve people across the community. Some northern health units have even further distances to travel. And so the province does provide a certain type of funding for areas that are more remote, not covered by municipality services in the same way. So that kind of dedicated funding approach from the province doesn't exist for Ottawa, but it would be part of our process as we build our budget to make sure that our services are able to reach everybody.
Thank you.
Thank you for the question, Member Dudas. Member Gower, please.
No further questions. Thank you.
Member Kavanagh.
No further questions. Thank you for the report.
Member King.
No questions, but also thank you for the report.
Member Lakin.
No questions, thank you.
Et Membre Pinel.
No questions and thanks for the report.
Thanks, everyone. So can we receive the presentation? Thank you. We will move to item 8.5, the 2023 draft operating budget for the Ottawa Board of Health. And I will be making just some opening remarks. So as is the normal practice when tabling the draft budget, the staff report and draft budget documents are just now being distributed to members of the Board of Health. So for those participating electronically, this is being done via email. So I would ask my colleagues to please check their email inboxes for those documents. Dr. Etches will provide some opening remarks, and then we will hear from Ms. Henderson-White to provide an overview of the draft budget. So given that members are just now receiving these documents and the presentation, only high-level questions on the presentation will be in order at this meeting. Detailed questions, motions, discussion, and debate on the content of the 2023 draft operating budget will be held until the subsequent meeting, which is scheduled for Monday, February 27th. And at that time, the board will have an opportunity to hear from public delegations and also be considering and voting on the 2023 draft operating budget. So I would also like to ask if board members are considering bringing forward any motions on the budget, that these be shared with myself and the board secretary as early as possible in advance of the February 27th meeting. And staff are, of course, available to assist with drafting the motions. So with that, I will turn it now over to Dr. Etches for some opening remarks.
Thank you, Chair. I really want to keep it very simple and just acknowledge that this is another transitional year. So what you're looking at as the Board of Health for the 2023 budget is not the usual, the same as last year and the year before that. It's a hybrid of our regular base funding and COVID supports that we expect from the province. And so I do want to start out also by saying our great appreciation, say thank you to the province for coming through, for doing their part to make that commitment to fund extraordinary COVID expenses from 2020, 2021, 2022. It's really been critical. And so I also want to acknowledge the work that it takes to put a budget together. And we have, I believe, online, so not in person in the room, but some of you would remember Svetlana Valkova. She is working with the financial services unit of the City of Ottawa. So she's the account manager that supports Ottawa Public Health in all of our finances and accounting and preparation of the quarterly reports and the budget. And so really want to say thank you to you, Svetlana, and your team for putting this material together. And I want to thank Joanne Henderson-White, who's acting as the manager for performance and corporate services. Really brought herself up to speed on what we're doing here at Ottawa Public Health and our priorities to be able to put this together with a lot of expertise and support from Samantha Gostin, who's a program manager for lead for finances and scheduling, who has the longest history, I think, on the financial file with Ottawa Public Health of the three people that I just mentioned, but all involved and greatly appreciated. So over to you.
Thank you again, Chair, and I will proceed with the presentation. Ottawa Public Health has worked with the city's finance department to finalize its 2023 draft operating budget, which will be tabled at tonight's meeting. The proposed operating budget focuses on lessons learned from COVID-19, input from Ottawa community members, partners, and the OPH team. Some of what we heard from these sources included the need for OPH to be resourced in a manner that allows for agility, preparedness, and recovery. Tonight's presentation will include some key messages, the assumptions and directions on which the budget was developed, an overview of the 2023 budget highlights and summary, including budget changes, and an overview of the 2023 budget timelines. We are tabling a balanced budget. We are mindful of the pressures that may impact on services and finances over the next year and on upcoming year in 2024. We are focused on returning to our full scope of practice, including chronic disease and injury prevention, promoting mental health and substance use health. We are also mindful of the risks, for example, of another outbreak, primary care shortages, OPH workforce fatigue, and temporary teams with temporary resources. And this may impact on operations and resources during the course of 2023 and potentially into 2024. We actively seek opportunities to innovate, provide culturally safe and informed services that maintain public trust, and to create pathways to equitable access to services, recognizing the unique needs of the populations that we serve. Working with guidance from an active board, we continue to build strong partnerships and seek opportunities for growth in our base budget to support resumption and growth in our programs and services. These are the assumptions on which we have built our budget. We are operating under the direction that the anticipated tax-supported inflationary increase is capped at a range of 2 to 2.5%. In other words, funds from taxation will be capped within this range. Funding formulas of up to 70% provincial and 30% municipal remain unchanged from 2022, and the province continues to support us with mitigating funds to account for the 2019 reduction from the 75 to 70% range and 25 to 30%. This budget reflects the need for continued COVID-19 response at a lower level until the end of 2023, with quarterly reviews, including temporary staff reviews. These estimates do not reflect the potential risk of resurgence of COVID-19 and potential outbreaks. Every position in OP's base budget and temporary roles supported by COVID-19 one-time provincial funding has been reviewed to examine how best to meet the requirement to deliver positive health outcomes and to maximize allotted funding. The focus remains continued COVID-19 catch-up, vaccine catch-up, and program areas that were reduced or suspended. Reimagine and recovery costs are not accounted for in this new budget. (2023) is a transition year focused on the resumption of services and recovery. We will continue to reorient OPH programs, services, and approaches with lessons learned from the pandemic, specifically to increase practical actions to promote health equity and measure outcomes, increase capacity to respond to greater infectious disease and immunization pressures, build on partnerships with health system and other organizations for coordinated and connected care, and prioritize work to ensure sustainable workloads. And the graphic that you see is what we looked at in terms of resumption of services and what we heard from the community, which I've just summarized. The following are the 2023 budget, the budget of health highlights. The budget highlights, sorry. Tonight, as I indicated before, we table a balanced budget. It is aligned with the City Council direction for 2023. It assumes a 0% provincial base increase from the province and assume that all one-time COVID-19 costs will be provincially funded at 100%. The draft operating budget is for a total of 128 million, which is broken down between 77 million of base funding and 51 million of one-time COVID-19 funding to cover the costs associated with COVID-19, for example, vaccinations and so on. Revenue from the province is anticipated at a total of 99 million, and revenue from the city totals 27 million. The budget changes, as you will note, for 2023 include an inflationary growth base budget increase of 1.2 million, which represents a 1.5% increase in our budget from 2022 to 2023. And this is adjustment which is allows us to address the cost of living or COLA. Other sources of revenue include the Ontario Works Dental fees and the AIDS Bureau funding. And the 70% to 30% ratio where the province provided us with the higher amount remains unchanged from the last year. This is a slide presents the budget approval timelines. After tonight's meeting, the Board of Health draft operating budget will be tabled with City Council on February 1st and then return to the board on February 27th for public delegations and approval. There will be opportunity for public feedback throughout the month of February, with further discussions at the City Council meeting on March 1, 2023. This concludes my presentation. Merci. Thank you.
Thank you very much for the presentation, and to you and your team for all of the hard work. So we will go to questions, comments, starting first with Membre Pinel.
Thanks for the budget. Everything seems to be very well planned and very well done. So thank you. No other questions.
Thank you, Membre Pinel. Member Lakin, please.
Thanks, Madam Chair. Thanks for the presentation. I just want to clarify, I got this here. The assumption is we have 0% increase from provincial base, effectively the same in municipal funding, except for a one-off, one-time pop of 1.24 million. Otherwise, municipal contribution is the same as 2022. Did I get that?
That's correct. It's
Hang on, I gotta
it's
plug
an
in.
annual contribution from the municipality. I wouldn't characterize it exactly as one-off because the municipality consistently has helped us with the pressure on our base that's due to collective agreement obligations. So the cost of living allowance. And so that is what the 1.2 covers.
Right. Okay, so otherwise the city contribution remains the same. There's
Yes.
no change to that. Do we have any sense whether that one-time contribution will continue in 2024 to offset the COLA for 2024? Do we have to, there's no assumption that that would continue on forward, but is there?
We have no reason to doubt that the municipality would change their approach, which has been to continue the 100% one-time funded programming dollars, as well as the base that's cost shared.
That's good for now, thanks.
Thank you, Member Lakin. Member King, please.
No questions. I just really appreciate the clarity in terms of outlining the expenses, the revenue, as well as the budget timeline process, as well as the public consultation process. So thank you so much for the hard work.
Thank you, Member King. Member Kavanaugh, please.
Thank you. Should I assume that from the city that you're getting a 2.5% like the rest of the programs across the board?
I'm sorry, I did not hear what your question.
For the city is increasing its budget 2.5%. Is that the same for Ottawa Public Health?
Yes, it is. So the range that the increase is capped between a range of 2 to 2.5%.
Thank you.
Yes.
And that's the tax supported portion of the increase. The municipality is also treating us the same as other departments when it comes to revenue from growth. So it's both the tax supported revenue and revenue from growth that go into that 1.2 million from the city.
No more questions? You're good. Thank you. Member Gower, please.
Thank you for the introduction. No questions and looking forward to further discussion on the 27th. Thank you.
Thank you, Member Gower. Member Dudas, please.
No questions as of yet. Thank you.
Vice Chair Di Giovanni, please.
Thank you for the package and congratulations. It sounds like many are new to Ottawa Public Health. It's really impressive and well done. So thank you for that. Just a question to follow up on the COLA increases. Are there collective bargaining agreements that are coming due this calendar year? And we wouldn't discuss the assumptions, but are those assumptions built into the budget?
So I'm happy to answer first, but very simply, no, we don't have any collective agreements coming due this year. We are starting into discussions with the CIPP union, but we're the early days. And if an agreement results in different pressures on our budget, that is something we would report back to the board as requiring in-year adjustments.
Perfect. Thank you.
You know, if you wanted to add anything.
So I think this what I mentioned in the Finance 101 about changes, any changes that occur or one-time changes or unexpected changes that would occur. Those would be issues that we'll be bringing before the board, and it would be the same expectation if there was any collective agreement related issues or matters that we need to take into consideration. They would be treated the same way.
Thank you.
I just wanted to check online because Svetlana Valkova, did you want to add anything to the discussion?
Sorry, I have nothing to add.
Okay.
No further questions.
Thank you, Vice Chair. Member Carr, please.
Hi, I just have a question. So I understand, so you confirmed with the province that they will continue to fund COVID-19 related extraordinary cost for the next year, but you're assuming that the base provincial funding for other programs will remain at 0% for all programs. Has that been confirmed with the province, or that's just an assumption?
So normally the increase is between 0 and 1%. And we're assuming that the same for this year, 0%, no change.
Thank you.
Thank you, Member Carr. Member Bannon, please.
Thank you for the presentation. No further questions.
Thank you. And I'll add my own thanks for the presentation and just the clarity, and look forward to further discussion on the 27th. Okay, so can we, so we're going to vote separately on each recommendation. So that at its meeting of January 30th, 2023, the Board of Health for the City of Ottawa Health Unit 1, receive and table the 2023 draft operating budget for the Ottawa Board of Health. Is that received and tabled? Thank you. And 2, direct staff to bring forward the 2023 draft operating budget for the Ottawa Board of Health to Ottawa City Council on February 1st, 2023, as part of the City Council's tabling of the City of Ottawa 2023 draft operating and capital budget. Is that carried? Thank you. So moving on to item 9.1, this was the IPD update on access to primary care for Ottawa residents. So I know some board members had questions. You can maybe just raise hand for this one. Sure, Councillor King.
Thank you so much, Chair, and I'd really like to thank Ottawa Public Health for undertaking this update on access to primary care for Ottawa residents. We know that there's approximately, according to the report, 100 to 150,000 people within our region who do not have a family doctor. And we also know that the wait list for referral in Ottawa has been quadrupling since 2017. We know that referral for a doctor is frequently required for access to healthcare services, and having a family doctor contributes to better health outcomes, enhanced patient quality of life, and improved health system costs and efficiencies. And I'd also like to thank you for acknowledging the challenges that new immigrants and equity-seeking groups have in terms of poor outcomes if they don't have a family doctor. We know that there's been conversations amongst my own colleagues at Council, as well as potentially in the mayor's office, about initiatives to increase recruitment. And in the report, I noted that I guess Ottawa Public Health had noted that it would be the health teams that would be leading some of the initiatives around that, and that OPH would be undertaking more of the data role in terms of convening. And I also congratulate you and thank you for that, because I know before the pandemic and at the beginning of the pandemic, there was concern, especially in the Black, Indigenous, and racialized communities, about having quality data to access. And I know that you've been working hard and your team has been working hard on that. So suffice to say, I'm just curious as to politically, who should Council or the mayor's office be working with? Should we be primarily working with the health teams in terms of this conversation of increasing recruitment and retention, or should we be primarily working through Ottawa Public Health?
Thank you. I think you did a good job of clarifying how we are, as Ottawa Public Health, are aiming to support solutions to this really significant gap in support and access to primary care. And so we would define our role as helping to assess the problem, diagnose the problem, and so that people can understand where to start, where are the gaps the greatest, what's needed. And we are also playing a role to bring people together to make sure everyone understands the data across different stakeholder groups, and that we hear from populations who might not be represented in the data exactly. So like hearing from the Ottawa Newcomer Center, that their wait list is so long, they were set up to serve people for a year and then transition people to a different primary care provider, and that's not possible anymore, that transition. So putting it all together is really one of our roles. When it comes to using that data to bring forward solutions, really the place we start conceptually for Ottawa Public Health is with Ontario Health. They have an East region that includes Ottawa, and they are looking more and more at primary care as the foundation for the health system and what can be done to strengthen primary care. They have two new primary care leads for the East region, and we could certainly circulate information after the meeting about who those primary care leads are for Ontario Health in the East. And one of the mechanisms, you're right, to actually make the services available and change what the experience is on the ground in terms of access is through the Ontario Health teams. And in Ottawa, we have 3 Ontario Health teams that serve the general population, and the Kids Come First team that really supports children and youth. So my advice would be to continue to bring those stakeholders for the health teams into the conversations around solutions. And I know they have ideas, as well as, there are other leaders in primary care who have information and data and evidence-based solutions and thoughts. When you think about some of the academic leaders from the University of Ottawa, the Department of Family Medicine, and there are other networks of primary care providers that exist. No one network speaks for every primary care provider in Ottawa, but there are family health teams, and you can reach those who provide care to designated populations. The community health centers also are a really important partner in providing primary care access, sometimes to populations, again, that have greater barriers to health. So they need to be part of the conversations and are interested and are part of the conversation. So, I think these the conversation goes beyond just recruitment and retention. I think that's another thing. You can only recruit and retain, people that exist. If there aren't enough primary care providers, it's also a question of being creative about how we support primary care providers, whether they're family doctors or nurse practitioners, even pediatricians who provide primary care. Pharmacies now are starting to provide more primary care. It's really taking a look at how do we support these practitioners to work in a way that's supporting more people per practitioner. And so, are there different ways that people can work in a team, people can have support for administrative tasks? These are all conversations that our partners are having.
Well, I really appreciate the fact that the update came at this juncture, because I think that we've heard very clearly from all participants within the city, all stakeholders, that we need forward movement. I know that at council last term, in terms of a motion I moved, that council unanimously asked the mayor to write to the premier and to the Minister of Health requesting that substantive action be taken on waiting times for Ottawa residents in need of a family physician. And I know that there's going to be action that's going to be taken. And I think that this report is a great first step in terms of providing, in a sense, a roadmap towards a more holistic and inclusionary approach towards that goal. So I just wanted to thank you and thank the team for the update. Thank you. Thank you, Chair.
Thank you, Member King. Member Gower, please.
Thanks, Chair, and thank you to the Ottawa Public Health team for preparing this report. I know the numbers are an estimate, 100 to 150,000. That's quite a big swing, and it's likely worse than that, given some of the changes we've seen through the pandemic. But I do think it's really important to have this kind of data. Anecdotally, I know counselors hear all the time about the challenges that residents have in finding a family doctor. I hear it certainly from people who are new to the Stittsville community. But I think having these numbers are important to give us a baseline to advocate with and to also measure against as we try to improve things. There was another one last fall, which was a CBC study that showed there were 1,200 family doctors in Ottawa and only 3 were accepting new patients. So again, a stark reminder of how challenging the situation is. There are probably no easy solutions, but a lot like the housing crisis, I do think it's something that each level of government, municipal, provincial, and federal, has a responsibility to address. And on that end, I know the mayor's office is convening a roundtable of physicians next week to have a conversation and start looking at ideas that can be used and what we can do at the local level. I was curious if there's any way that through future work, you can measure how Ottawa compares to other jurisdictions in Ontario. Perhaps there's other public health units who are doing similar work. And I mention that because I've had 3 people in the last 6 months who've recently arrived in Ottawa from the GTA, from the suburban areas of the GTA, and 3 separate communities. And each one of them have told me it's a lot easier to find a doctor in the GTA than it is in Ottawa. And I'm curious if that's actually true. And I'm also very curious if it is true, what would the reasons be behind that? And I think some of that information would help us in understanding where we might be able to go as a community to try to tackle this problem.
Sure, I'm happy to comment on that. Don't know what happened there. Are we okay? So, okay, sorry for any feedback there. I think the first thing that has to be said is that it's not even as simple as counting the family doctors. So when you say there were 1,200 family doctors and only 3 taking new patients, certainly we know that those 1,200 people that might be on paper as family doctors are not providing necessarily what we would think of as primary care. They could be working in hospitals, they could be working at Health Canada. There's different roles that family doctors can play, and it doesn't always mean that people are available to see people as we think of a typical family doctor, you know, from birth to death and for anything that happens to your health. So I think we have to have some more nuanced ways of calculating the capacity that we have for primary care in the city. And this is part of what Ottawa Public Health will keep working on with our partners. We're trying to find other measures that give us a better sense of actually what is the capacity for primary care. As we would define it, that full scope of practice. And so some of these things we then need to have standardized ways of measuring to be able to compare across jurisdictions. So we'll continue that work. I will take away your request about comparison to the GTA. I think there probably are some ways we can look at comparable data and get back to you. I think the other thing we are planning to do, as you could see maybe in the report, was to continue to bring our level of understanding down to the neighborhood level. Because, and I noticed that already this evening, you know, people were asking about rural areas, you know, the African, Caribbean, Black population. So we will continue to work with partners to get more refined data also to direct solutions. But so some of that information won't take too long to come. We know there's some updated information will be available not too long about neighborhoods, but some of these other measures of access and capacity, you know, I think we have to work with partners across the province to best understand that. So I'm not sure if that answered your question, except that we'll come back with a little bit more context for you. This isn't the end of the story when it comes to data on primary care in Ottawa.
Yeah, no, that's very helpful. Thanks very much. And I'll be following the next steps closely on this. Thanks, Chair.
Thank you, Member Gower. Do we have any other questions? This item, we're good. Yeah, I just wanted to add, I couldn't agree more with my colleagues and really want to thank you for undertaking. I think the data collection is a very important step. As counselors, we're hearing a lot of anxiety about this in our communities, and I think it's very comforting to know that, as always, OPH is being such a collaborative partner and looking for solutions. So thank you. With that, we will move on. There's no in-camera items. So motion to adopt reports. Member Carr, please.
Be it resolved that the report titled Election of an Interim Chair and Interim Vice Chair, the Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, the presentation titled Introduction to Ottawa Public Health Finances, and the report on attendance at the Association of Local Public Health Agencies Winter Symposium be received and adopted. And be it further resolved that the report titled 2023 Draft Operating Budget for the Ottawa Board of Health be tabled for consideration at the Board of Health meeting of February 27th, 2023.
Thank you. We have no motions requiring suspension of the rules. Do we have any notices of motion? No. Confirmation bylaw, Member Carr.
Be it resolved that confirmation bylaw number 2023-1, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of January 30th, 2023 be read and passed.
Carried. Thank you. Any inquiries? Seeing none. Just before we move to adjournment, I just wanted to note that Elder McGregor and Senator Berge did stay for the entire meeting. So miigwech, thank you very much. Good evening, but we will circle back on that. Thanks, everyone. Have a great evening.